The roots of your teeth are meant to be covered. Yes, the roots of your teeth are meant to be covered. They should not be left free in the oral cavity. They have been designed to be protected. The moment they are exposed, they start causing issues such as sensitivity, and then root surfaces are very, very prone to decay once they're exposed in the oral cavity. Hello guys, Dr. Kendi here, and welcome to this week's episode of My Oral Health Diaries. This week I am going to be discussing the warning signs of gum disease. So there are many articles and many resources about gum disease, but what exactly should you be looking out for with regards to gum disease? What are the warning signs? What should you pick up early? Now with gum disease, the bad thing is it's like a silent killer. It's not painful, so you can have it for a really long time. You're not going to be getting hurt, but something is definitely going to be going on. So we really need to be cautious about the warning signs we are going to discuss today, because in as much as we're saying gum disease is silent, it cannot camouflage, it cannot hide. So we are going to be discussing 7 key points that we use even as clinicians to check on the health of your gum. So the first thing is normally bleeding. Now, bleeding gums are not healthy. Like, gums should not bleed. Some people come to the clinic and they're like, my gums have been bleeding for like the longest time. But that is actually not a good thing. Bleeding with your gums is like a cry for help from your gums. It is normally actually like the earliest sign of gingivitis. Before your gum actually becomes inflamed or swollen, there is going to be bleeding. Bleeding may occur either spontaneously or upon provocation or induction. The one that happens spontaneously is of more concern to us because most of the times it's normally caused by systemic factors like platelet deficiencies and other genetic conditions. So it's actually something alarming. If your gums are bleeding spontaneously, kindly make sure that you consult your dentist. Now, when we talk about bleeding upon provocation, that just means either you're brushing your teeth and then you spit and you see blood, or when you go to your dentist and they check, they use something, or we use something called a probe. So when we check, when we're checking the health of your gums, we use that probe. So if we put that probe in the sulcus, remember we said the sulcus is that area between the tooth and the gum. There's that space there. That's what I'm referring to as the sulcus. So when the probe goes in the sulcus and there's bleeding, then there's an issue there. Now, there are very, very many things that may cause your gum to bleed, and we've said the major one is normally inflammation. And the things that cause inflammation are like 20, there are like so many. But most of the times your gum is inflamed as a result of plaque. Plaque is the #1 reason of gingivitis. So everyone has some type of gingivitis or some level of gingivitis, because we said we are never achieving 100% efficacy during brushing. So there's always some plaque here and there. So your gum may be swollen here and there, but it should not be bleeding. But that's basically one of the major reasons that causes gingivitis, plaque. Now, I don't want on this episode to like really go into gingivitis because it's like a whole topic on its own. But it's important to recognize that gingivitis would appear first as bleeding. I'm going to emphasize that point. Bleeding is a sign of gingivitis. Now, other things that may cause bleeding in your oral cavity may be things like maybe you've had a filling done and there's something called an overhang. When a filling is done on your tooth, if this is your tooth and this is the filling, it should be flush. There should be no step, nothing there. When there's a step, we call it an overhang, because then, as we discussed on the previous episode, we do not want anything that is rough on your tooth surface. So whenever there's an overhang, this may also cause for your gums to bleed. Another very common thing that may cause bleeding, of course, in your gums is Probably trauma. So maybe you're eating, and when we say trauma, I know people think of it as something huge, tumepata car accident or something like that, but you know, trauma in the oral cavity could be something really small, like you're eating popcorns or crisps and then they just, you know, kind of like go into your gums. That is a type of trauma, and it may cause your gums to bleed. But bleeding, basically, as we've said, is not a good sign. It is a sign of gum disease. Let me go to the next point, otherwise I'm going to spend the whole time just talking about gingivitis, but we will definitely look for a session and just discuss gingivitis on its own, or gum inflammation or enlargement, a whole topic on its own. Another thing you should be on the lookout for with regards to gum disease is color change. Now, normally the gums are a healthy kind of like pinkish red, but during gum disease, they change color and they become, it's like they become angry, they become dark red. That's not a healthy color. Another thing that may be happening in your mouth is something we refer to as physiologic pigmentation. This is a normal thing. I think I've had about like 5 patients coming in and they're like, my gums are black, but we are Africans. Physiologically, we have melanin and all that, so that contributes towards that black. I don't even think my gums are red. Are they red? I think mine have that black, and it's okay. It's okay for us, if you're people of color, to actually have that pigmentation on your gums. But sometimes you may have some pigmentation as a result of something else, like a heavy metal, such as amalgam. Amalgam is a type of filling we use in dentistry. So that's also a sign. Gum disease may develop from there, because your gum is going to be irritated as a result of that. If the amalgam is leaking and there are those little particles getting into the gum, you may notice that your gums are becoming, we call it amalgam blues. So your gum is becoming sort of bluish, darkish. Yeah, so color change is a thing that you also need to be on the lookout for. Another thing we need to be on the lookout for is the consistency of our gums. Our gums ideally are like firm. They are not smushy or squashy. They are like firm, especially the top part. Now, the gum has 2 different portions. There's like the attached portion of the gum and the part at the bottom. Let's try and see over here. Yeah, this may not be a very good demonstration, but it's like normally around up to this point here where the gum is attached. So when you touch it, it's very firm. It doesn't feel fluctuant or soft. Fluctuant is like when you put water in a balloon and then you squeeze it, that's fluctuant. Firm, you want it to be like pressing on not a table, a very hard table, but something like a chair that is not very spongy. So it's firm, not squashy. So you need to always look out for the consistency of your gum. Another thing you need to be on the lookout for is the texture. Now, your gum ideally should be smooth, not very smooth. It has an appearance, we call it an orange peel appearance or a stippling appearance. If you actually dry your gum, you'll notice that it looks like it has very tiny dots around there, and that is healthy gum. But if you dry your gum and you notice that it's just smooth and shiny, then that means that that gum is edematous or it's swollen. There's something that is happening in that gum. So look at the texture of your gums. I think I normally advise that you get a mirror if you don't have one in your house. And when you're brushing, you need to look at your oral cavity. It's not anything to be embarrassed about. Like when you're brushing, make sure you brush properly the way we discussed. Have a look at your oral cavity, see how your gums are doing. Once in a while, rinse your hands and just try and go around your teeth and check. Is there any place you're feeling tenderness? Is there any place that is not okay? We need to be a bit aware about that. Something else we need to be checking is the position of your gum. Now, your gum should come up to, we normally say close to the junction between the top part, which is the crown, and the root. Your gum should be reaching that point. Sometimes this position changes. It goes lower in some people, and in some people it goes higher. When it's going higher, then it means that your gum is enlarged, and that is something for you to be concerned about. When it's going lower, we call it recession, gum recession. And it's also something that you need to be worried about. The roots of your teeth are meant to be covered. Yes, the roots of your teeth are meant to be covered. They should not be left free in the oral cavity. They have been designed to be protected. The moment they are exposed, they start causing issues such as sensitivity, and then root surfaces are very, very prone to decay once they're exposed in the oral cavity. So we need to be cautious. If you notice that your teeth are looking a tad bit longer or a tad bit shorter than they're supposed to be, definitely something to be worried about. I'm on the last point now. The next thing you should be on the lookout for is the contour of your gum. Contour is just the way it's shaped. It's like scalloped very evenly and very nicely. I'm sure you are seeing in the photos we are projecting a very nice scalloped, appearance. The moment you notice that your gum is having bumpy areas or, it's not evenly scalloped as it used to be, then there's definitely a problem. Most of the times they are like lesions. Lesions are just like swellings that start from the gum. And this may affect the natural contour of the teeth. Of course, in terms of contour, we would also mix with the position, because then if there's recession, then there's also change in contour or the normal scalloping of the gum. For me, these are like the 7 things that we look at, even clinically, when we're examining patients to check for the health of your gum. It's important that you also do this for yourself, and you can do this even for your children if you're checking on their health, on the health of their gum, so that you can, be more on the lookout for any change. Thank you so much for joining us on this week's episode of My Oral Health Diaries. I hope you learned something about gum disease and what to look out for. This will help you take good care of your gums. And of course, if anything is happening, you would be, on the alert, so it would be caught early. Keep engaging us, keep asking questions. Kindly feel free to leave comments in our comment section. And tell us what you would like for us to discuss, or even ask on what we've discussed. If you feel like something has not been expounded on, feel free to do that. Otherwise, let's keep liking, subscribing, and sharing this video. Let's keep learning more about oral health. And I'll see you on the next episode of My Oral Health Diaries. Sura yako mzuri mama. Hey! Sorry, usikomeka hiyo alafu nikute nimeweka hapo hivyo mwisho. Go to like, oh my gosh, who is that? Oh. And nimesahau Greg.